Let's keep moving forward with our myth busting today. So, we're going to tackle a short one here, but it's one that we don't talk about a lot of times. So, we have this subset of women out there who are migraine sufferers. And typically, at some point in their life, women who have migraines are told to never use hormones. They get really scared of this. They've been told it by multiple doctors, maybe no birth control. When you reach menopausal age, you're not a hormone candidate, things like that. But that is because of old, outdated information. So, women who suffer from migraines, we know are already at an increased risk of stroke. And we don't want to do anything that's going to increase that risk. And many years ago, when oral estrogen was really all we had and all we used, it was studied in the Women's Health Initiative and shown to increase a woman's risk of stroke. So, if a woman were to take that oral estrogen, increasing her risk of stroke, and is already at an increased risk because of migraines, we're just compounding that risk. And of course, in medicine, that's not what we want to do, right? We want to keep women healthy and thriving. So, with that, oral estrogen wouldn't be an option. However, we now have multiple topical estrogen options that do not increase the risk of stroke. You see, it's not estrogen that increases the risk, it's swallowing estrogen that increases the risk. So, if you are a migraine sufferer, sometimes they get worse as we transition into menopause, and that sounds pretty miserable. But the good news is you don't have to avoid your hormones. We can go ahead and use hormones in that menopausal transition as long as the estrogen is topical without fear of increased stroke risk.